Hello everyone, and this is Dr. Zaim. I'm the Medical Director of Pinnacle Family Services. Today's talk is epilepsy and seizures in children and teens, and I hope that you find this talk useful. So let's look at some of the definitions and facts about epilepsy and seizures. Seizure can be defined as a brief episode of abnormal, excessive, or synchronous activity of the nerves in the brain, which can cause wide-ranging signs and symptoms. So somebody who has a seizure can have symptoms ranging from jerking movements to a momentary loss of awareness. Epilepsy is a state where it involves recurrent unprovoked seizures. So if you have somebody who has recurrent unprovoked seizures, then they would have epilepsy. Depending on which area of the brain it's affected, seizures may look different and feel different from one person to the next. For example, if a person has seizures in the frontal lobe, it looks very different than if it happens in the motor area of their brain. Epilepsy is not uncommon. It's estimated that around 3 million people in the United States have epilepsy, and 1 in 26 will develop epilepsy at some point in their lifetime. Unfortunately, 1 out of 3 people with epilepsy live with uncontrolled seizures. And the reasons can vary from the patient not seeking help, the seizures not being controlled effectively, or the medications not working. 6 out of 10 people with epilepsy, or 60%, the cause for it is unknown. The causes that we do know are pretty much can be categorized based on age. So if you look at a newborn, and if they have seizures at the time they're born, you think of several things. These could be either due to brain malformations, lack of oxygen during birth, low levels of blood sugar, blood calcium, magnesium, or other electrolytes such as sodium, potassium. They could have an inborn error of metabolism, such as urea cycle defect. They could have intracranial hemorrhage, which is bleeding in the brain tissue. And it could also be caused by maternal drug use. So if the mother has used drugs, when the baby is born, they could have seizures. If you look at older infants and children, you find that fever and febrile seizures are the most common cause of seizures. So these children, usually toddler age, they develop seizures when their fever goes very high. That is not a serious condition, and usually controlling the fever will control the seizures. And these seizures are not dangerous or usually a problem. And as I said, as they get older, they outgrow these seizures. A rare condition that can lead to seizures in these children is brain tumor. You are going to find that during the testing and assessment, there's usually CT scan or MRI done to look at the brain tissue and structure and make sure there are no tumors as part of seizure workup. Another cause of seizure and epilepsy in older infants, toddlers, and children are infections. And these infections can range from serious ones like meningitis to other ones such as pneumonia, etc. In children and teens and adults, the causes could vary from congenital conditions such as Down syndrome, Angelman syndrome, tuberous sclerosis, or neurofibromatosis. These are all diseases that some children could have. It could be genetic factors involved. Rare progressive brain diseases can cause that. And of course, trauma to the head and to the brain can cause that. In seniors, the causes are more related to either stroke, Alzheimer's disease, or again, trauma to the head. Please remember, in majority of people with epilepsy, the cause is unknown. So let's talk about the triggers. So first we talked about the causes, now let's talk about what can trigger seizures. The first obvious one is when the medications are missed. So let's say a patient is on anti-seizure medications. For whatever reason, if they forget or are not given their medications, they can have seizures. So it's very important for their medications to be given on time and on a schedule. The other thing I want to mention is that sometimes these children, as they grow, the amount of medication that worked for them before might not be enough. So it is important for their blood level to be checked on a regular basis as they grow to make sure they are being given enough medication. Lack of sleep or disrupted sleep is another very common cause. So it is very important for these children to get enough sleep and restful sleep. Illnesses can sometimes trigger it, with or without fever. I would say stress of any kind, psychological, physical, etc., can trigger seizures. In teenagers especially, heavy alcohol use, cocaine, ecstasy, or other drugs can trigger seizures. Some of the over-counter drugs, prescription medications, or supplements can trigger seizures in a child who has epilepsy. Benadryl being a common over-the-counter drug used for allergies in some patients can trigger seizures. So it is very, very important before you give a over-the-counter medication or a supplement to check with a neurologist or the healthcare provider about the safety of these medications or supplements for these patients. Certain nutritional deficiencies, vitamins or mineral deficiencies, can trigger seizures. For example, in patients with calcium or magnesium deficiency, seizures can be triggered. Poor eating habits, such as going for a long time without eating, therefore triggering hypoglycemia, or going a long time without drinking, causing dehydration, can trigger seizures. In women, in female teenagers, their menstrual cycle, with the start of their menstruation, or during different parts of the menstrual cycle, as the hormonal level changes, that can trigger seizures in them, as it can if they go on any hormonal therapy for birth control, etc., that can also induce seizures. Another very interesting factor are flashing lights. Flashing lights can trigger seizures. I remember having had a patient who, she was a teenager, went to a dance club, and the flashing lights on the dance floor triggered seizures in her right on the dance floor. Certain activities, loud noises, certain foods, etc. can also trigger seizures. So as you can tell, these triggers are multiple, complex, and sometimes unknown. So how many types of seizures are there? Well, we could categorize seizures into two major types. Type 1, I would categorize as primary generalized seizures. These are seizures that the electrical discharge is widespread, involves both sides of the brain at once. There's usually loss of consciousness, and it happens without warning. Hereditary factors are important in many of these seizures, and there are many subtypes. Tonic, tonic-clonic, clonic, myoclonic, it all depends on the presentation of the seizure. The pictures show a tonic phase and a clonic phase of a child having a seizure. And the picture on the right is a clonic phase of a generalized seizure. There are also another type of generalized seizure called absence seizures, which are common in children, and I want to talk to you a little bit more about those. So, absence seizures are a form of primary generalized seizures, and they are very interesting in their presentation. They can cause a sudden lapse in awareness, which sometimes can just look like staring, and last only a few seconds, and begin abruptly and end abruptly. It is most common in children, and because of the way it looks, which is looks like the child is staring or daydreaming for moments, or just stop doing what they're doing for a few seconds and then they go back doing what they're doing. These seizures are difficult to detect, and these seizures might go undetected for months or even years. The second type of seizures are partial seizures. They can be subcategorized as simple and complex. Usually the partial seizures begin with an electrical discharge in a limited part of the brain, not the whole brain. Partial seizures are often preceded by a certain experience known as aura, and these could include sensory auras, visual, hearing, smell, psychic auras, autonomic or motor phenomena. So sometimes these patients, before they have a seizure, they might smell something funny or hear a musical tone, etc. So it's a very interesting seizure. I want to give you an example of a frontal seizure that shows how diverse and sometimes bizarre these seizures can look. In the literature, recently there was an example of a frontal lobe seizure, and this was an 18-year-old man, teenager, who was brought by his mom for an opinion after this teen was suspended from college for threatening to shoot his teacher and classmates. Apparently, he would have behaviors where he would suddenly start speaking profane language with threatened aggression, using his hands as a stylized gun to track moving people and shooting them. Because this was out of character for this teen, the mother brought him to the doctor to see if there could be other explanations for his behavior. And sure enough, when they hooked him up to an EEG machine, they noted that he was having bifrontal rhythmic activities during seizures. A further, more detailed study using video EEG monitoring captured 14 seizures in the wake and sleep state. He also was exhibiting lip smacking, which is a form of a seizure seen in partial seizures, form of movement. And the patient was amnestic for a major portion of his seizures, didn't remember he was doing these actions or saying the things he was saying during the seizures. So how are the seizures diagnosed? Well, first and the most common way is to use EEG, which stands for electroencephalogram. So if you look at the picture on your right, you see a child hooked up with the EEG electrodes, which is recording brain waves. Now, if you look at the picture on the left side of your slide, you're going to see a normal EEG looks like the left side of that graph, where things are smooth and rhythmic. When the seizure starts on the right, in all leads of EEG, you're going to see abnormal, rapid activities of brain waves. As I mentioned before, doing a CT or MRI, which is a neuroimaging, might be necessary, especially if a child has had a first seizure, to look for any brain abnormality, any bleeding in the brain, any tumors, etc. For more complicated or difficult cases, it might be necessary to do video and EEG monitoring together. So the video recording and EEG is happening at the same time. So let's look at some EEG patterns. A normal EEG is depicted in the picture on the upper part of the slide. This is a normal brain on the upper part of the slide with normal smooth EEG waves. The partial seizure EEG looks like the one on the left lower corner, where only a part of the brain is involved and only a few leads seem to show seizures. On the right side, you see more a generalized seizure where all the areas of the brain are involved, and the EEG shows pattern of seizure in all the leads. So how serious are seizures? Complications can range from the most common, which is none or minimal, to injuries, emergencies, and even death. The chance of injury is higher for people with uncontrolled seizures. The type of injury a person may get depends on the type of seizure, how long the seizure lasts, where the seizure occurs, and if it develops into an emergency. So, for example, if the seizures can't be stopped or repeated one after the other, a permanent injury or death can occur, although rare. People with epilepsy can also die from problems occurring during or after seizures, such as inhaling their vomit and not able to breathe. They could also drown if they have the seizures while they're swimming or they're even in a bathtub. So, drowning in a bathtub, even with a few inches of water, has been reported. So the patient is taking a bath, has a seizure in the bathtub, and then drowns. So one recommendation is that people with seizures should probably stick to showers instead of baths. Please remember that despite these risks, it is rare for people to die from seizures, and that's a good thing. So how common is it to die from seizures? Let's look at the next slide. The sudden unexpected death in epilepsy, or SUDEP, happens 1 in 1,000 seizure cases. It's more common in people with poorly controlled epilepsy. About a third of the SUDEP cases show evidence of seizures close to the time of death, and there are many researchers with different opinions about the causes of death, and these vary from seizures causing irregular heart rhythm to breathing problems to other problems in the brain or other areas of the body. Fortunately, these deaths are rare in children. There are medications that are commonly used, and as our experience evolves, more and more medications have come into the market. They are commonly referred to their brand name, and I'll go through some of them: Tegretol, Valium, Zorantin, Lamictal, Keppra, Trileptal, phenobarbital, Dilantin, Topamax, and Depakote. Their generic names are also mentioned as well. And this is just a partial listing, and there are a lot more medications that can be used, and more is being developed. Besides medications, there is the integrative treatment of seizures, which involves adding other modalities to medications trying to help these patients. The goal of integrative treatment is promote emotional well-being, reduce anxiety and depression, increase coping strategies for living with epilepsy, and eventually even improving the frequency or severity of the seizures with certain methods such as diet, ketogenic diet especially, and certain nutritional supplements and herbs. Some of these methods have been scientifically studied and proven to work, such as the ketogenic diet, and some have not been studied. So what should I do when someone has a seizure? Well, you do not want to pull your hair out or panic. The first thing you want to do is stay calm. Remember, most seizures will last only a few minutes, and if you stay calm, they will pass. Always stay with the person until the seizure is over. It is important for you not to leave the child who is having a seizure. So what could you do? Well, the first thing you could do is time the seizure. So from the beginning of the seizure until the end of the seizure, when the patient comes back to full consciousness, time the seizure. It is important to note how long it takes for the person to recover from the beginning of the seizure, because the amount of time, if it's, for example, more than 5 minutes, will make it into an emergency. And it is important when you're reporting it to the neurologist or treating physician, you're accurate in the length of the time of the seizure. The other thing you want to do is prevent injury by moving nearby objects, sharp objects especially, as to not cause injury to the child who is having a seizure. So clear the area around them. Make the person as comfortable as possible. Help them to sit down in a safe place. If they're at risk of falling, get someone to help you and lay the person down on the floor. Support the person's head to keep them from hitting the floor. Another thing you can do that we highly recommend is, once you lay the person down, turn them on their side. So they're laying on their side. The reason for that is laying on the side will open the airway, and that way the person cannot choke on their saliva or their vomit. So turn them on their side with their mouth pointing to the ground and let them be at that position. Beyond that, you don't need to do much else. You do not want to hold the person down when they're having a seizure. That can cause injury to them and injury to you. Definitely do not put anything in the mouth. That means do not pull their tongue, do not hold their tongue down, do not do anything while they're having a seizure to their mouth. That includes not giving them water, medication, food, anything while they're having a seizure. You can only do that after they're fully alert. If this happens in the public, you need to ask someone to stay nearby in case you need more help and keep the onlookers away. Privacy is very important, especially when the patient comes around. When the patient does gain consciousness again, please be sensitive and supportive and offer help. Seizures can be frightening, especially for children and for people around them. So if someone is having a seizure, they might feel embarrassed, they might have urinated on themselves, they might be confused about what happened. Keep that in mind when you are with the person who is having a seizure. Reassure the person that they're safe. Once they're alert and able to communicate, tell them what happened in very simple terms. Offer to stay with them until they're ready to go back to normal activity, or call someone to stay with them if you cannot. And lastly, once the seizure is over and the patient is alert, notify the treating physician of the seizure and ask for guidance. Usually the physicians would like to see the patient in their clinic so they can run some tests on them. So to sum it up, when somebody's having a seizure, number one, stay calm, stay with the person, pay attention to how long the seizure lasts, move nearby objects as to prevent injury, make the person comfortable, make sure they're breathing by laying them on their side. Do not hold them down, do not put anything in their mouth, do not grab their tongue, do not give them water, pills, or food. Keep onlookers away, be sensitive and supportive, and notify the treating physician. Now, there is a case to be made for calling 911, and there are pretty specific cases. So if a seizure lasts more than 5 minutes or longer, if the seizures happen one after another without the person regaining consciousness between seizures, if the seizure is happening closer together than is normal for the person, if the person has trouble breathing, if the person is choking, if the seizures happen in the water, such as swimming pool or bathtub, if the person is injured after the seizure or during the seizure, if you believe this is the first seizure this person has had, or if the patient themselves ask for medical help. So if the person asks for medical help, that's another reason to call 911. So resources are available if you want to get educated more, if you want to learn more about what else you could do. The Epilepsy Foundation, which is run in cooperation agreement with Centers for Disease Control, CDC, is an excellent resource. So go to www.epilepsy.com and you will find a lot of resources there. I have marked down some of my favorite ones, and the last one, texting for control, in particular, I would like you to recommend to teenagers and young adults who have seizures. This new system, texting for control, is meant for users aged 13 and older with a mobile phone, and this system will send medication reminders, motivational messages through text messaging. So if you need any other resources to learn more about epilepsy, you can definitely use the Epilepsy Foundation. We've come to the end of the talk. I hope you have found this talk useful. You can send your questions through the med management team and system to me, and I will be happy to answer them. Have a great day.